Did anybody come across or sort of see or have to face anything which triggered something personal within themselves? And if so, how did you keep yourself safe and well?
I said, obviously, I was working in a mental health field, and I guess I hadn't really thought about the trauma that people experience potentially. And so when you're reading up on people's notes, just to get a bit of a history of them and kind of their interaction with the service, often you'll read about, not in detail, but kind of a little bit about the traumatic events that people have been through. And I think the volume of that surprised me a little bit. So I think it's helpful now that I know that actually you can come across some kind of triggers or other people's trauma in lots of different practice settings. It's not just mental health, and it's just really important to look after yourself after you've had a day like that. So go home, really try to switch off from placement, have nice weekends where I know you can't do everything fun at the moment, but like go for a walk and just really try and take time for yourself, and don't hold on to that as much as possible.
And speak to the lecturers. You can speak to absolutely anybody on the team. It doesn't have to just be your academic advisor, or it doesn't have to just be the placement supervisors. It can be anybody.
Yeah, and even like if you have a good enough relationship with your practice educator as well, and you feel comfortable with them, you can always mention it to them, and they might be able to actually help with either avoiding things like that or working it in a way that is kind of slightly more comfortable as well.
Absolutely.
Yeah.
The wellbeing service at uni as well, they have specific help sessions for people in from Marston Road mainly, support groups.
And I would add to that as well, and I would say that if you're in a situation with a patient or family members where there is something that's happening in the moment which is quite difficult for you to deal with, I think as much as possible you need to remember that you're a professional and you're there as a student and you're representing yourself in your university, and absolutely if you need to take yourself out of that situation or you need to step back and have a quiet 5 minutes, absolutely do so, but remember that you're a professional and you're going to come across that in your daily life. So for example, if you're working in a hospital and one of your patients dies, don't be there blubbing your eyes out, because that's not helpful for the family, and you know what I mean? So if you need to remove yourself from that situation, just do so.
Yeah, absolutely. Really sound advice.
I did my course visit to a adult learning disabilities day centre, and in my previous job I dealt with a particularly horrendous staffing situation at an adult learning disabilities day centre. So actually, and it was very traumatic, and we were quite heftily involved. It involved a staff suicide, so it's been a very difficult situation. And I thought about, I'd sort of forgotten about it, so it all came back. So I thought, how would I know being here? I wrote a reflection. I discussed it with my PE. So I had a brilliant PE. I wrote quite a long reflection on it, because obviously it was totally sideways to what I was there to do. It was and that's the problem with something that brings up personal trauma, isn't it? Not quite unexpected for me and not quite connected. So yeah. So that was that for me. That was how I dealt with it. I did write a long reflection, and I did have a long conversation with my PE about the sort of feelings that it created for me. Just worked through.
That sounds like it must have been really challenging and probably quite a shock to be thrown sideways in your course. But I guess this is really useful information for people to know that things might come up. I think also it's important to say that before placement, you can say that there are certain areas of work where you really wouldn't be able to work in, whether it was palliative care or a particular mental health unit. But yeah, I love that you did a long reflection on it. That's really good.
Yeah, so I was dealing with end of life patient. It was very sudden. and it was quite a rush to get them home to their preferred place to pass away. And yeah, it was really difficult, and it was very fast turnaround. And it was like a Friday afternoon at 2 o'clock. We found about this patient, so we were all like running around trying to get things ready. And it was, you kind of didn't have time to think about it at the time. But afterwards, everyone, like especially the band 7 therapy leads, were like, right, we need to debrief about this. They made sure that like just talked through what happened, so everyone was all right with it. And I brought it up in my supervision, and my practice educator was really understanding. And yeah, and also they do, if there is going to be something like that, and obviously not a lot of placements are dealing with end of life, and it's not usual for us, so it was quite a shock to everybody. But before we even got involved, my practice educator was like, if you feel like you don't want to do this, you don't have to. It's way beyond what you've got to do on a placement. Don't feel like you have to. So never feel like if there is a condition or something that is going to trigger you due to your past, definitely feel open to talk about that. The band 7s are amazing, and they will make sure they debrief you if you do decide to get involved.
Absolutely. Thank you for sharing that. Bryony.
So working on the neuro unit, I see a lot of people with traumatic brain injuries and subarachnoid hemorrhages, and people that have been involved in car accidents, people that have just suddenly fallen, spinal cord injuries. So these are all conditions that are very sudden, resection of brain tumours. So we see a lot of patients that are otherwise completely very, very healthy, otherwise have no previous medical history, and suddenly are very, very, very unwell with a lot of cognitive and physical impairments, suddenly almost in the blink of an eye. And I think one of the hardest things with that is you do see people, and you do see the mental toll that takes on them, and you do see the toll that takes on their family, especially when you're calling them up. And that is something that you can take home. And it is, I'd say the most important thing is that you take the time to look after yourself, you take the time to talk to your practice educator, you take the time to talk to your team. They're not expecting you to emotionally deal with everything you see, because you're not going to be able to. There is going to be something that will catch you off guard, and that's completely normal. It's just something somewhere is going to be too much. And if it is, you can take that time. You don't have to go and see that patient. You can just go and take that time just to recollect your thoughts, recollect yourself, have a drink, have a cup of tea, and get back to it. And it's going to be okay. It's just something that you do learn with experience, that it will just come, that it's something you can deal with. But the first few times, and even going forward with experience, you will just get the odd little patient where something just catches you off guard, and that is okay. And I think learning that that's okay, and these things aren't always going to be, a smooth ride, and you are going to see some things that might upset you occasionally. It's just something you need to learn, and it will come.
Yeah. Jana.
So because of COVID, the hyperacute stroke unit has kind of also become a general medicine unit. And so I don't only see people with strokes, I see people who have gone through a lot of things. But my PE does try to keep me only with the stroke patients. However, I do attend MDT meetings, and basically in one of the meetings, the doctors said that one of the patients was going to die a very painful death in a way that no one has ever seen before. And that was my second MDT meeting. And I was like, wow. I can't handle this, because the patient themselves had a lot of like medical issues that my grandmother had. And I was like, I did not want to hear that. And I'm not gonna lie, that day I went to the bathroom and I cried a bit, but then I came out, and like, as soon as you explain to your PE like things that make you not comfortable or things that make you feel like you can't do it. They're so nice. And like I literally, like one day I was like, oh, I'm anemic and I'm on my menstrual cycle, and she was like, if you wanna sit down and like if you wanna take a break, it's fine. Like some days you just cannot be standing up and walking from 8 a.m. till 4 p.m. It's something that not everyone can do, specifically on days where you literally just get dizzy by like turning your head to the right. And so they're very understanding of everything. And like it's just something that is a big part of like you being in your first week of like placement, where you're kind of like, oh, I can't ask, I can't do this, I'm too afraid, this is something that's going to bother me, but I'm too afraid to ask. Don't think that way, because I promise it's something that like as soon as you tell them, they're going to be like, oh, if you're not comfortable, it's fine. Like they're really understanding.
Thank you. Yes, Imogen.
I think everyone is always a bit worried about what the team are going to be like, but if you weren't there, they're all there for each other, and you are another member of that team, and that you are treated like that. And if you don't feel like you can deal with something, they're going to be there for you, and you just have to be honest. Don't build it up inside and then it gets far too much. They're all there for each other, they're going to be there for you, and they've got some fantastic tips on how to not take things home, what to do if it's all feeling a bit too much. And they're all there for each other, they're there for you. And just if you feel like you can't do something, or that patient's not going to be something you could deal with, they've all got fantastic tips on how to deal with that, and that's really handy.
I really do value your honesty, because it can be a difficult question for people to ask, because it does make you reflect. And you've all been really honest and very open, and I really, really do value all of that. And I know that future students will as well. And I think you touched on it, but reflections are so important, aren't they? And we get the handbook saying how much work you have to do and like what you have to submit, but there comes a time when you realize that your reflections aren't just a tick boxing exercise, same as your supervisions and preparing for your supervisions. They really are, they're really important to do, because it really helps to process what's happened and to think about what you can do next time in order to safeguard yourselves. My first patient that I had died, and he sounded and he looked exactly like so similar to my granddad, who died quite like not that long ago. So when I was treating him, I already had that sort of, I don't know, there was like, I thought, I was thinking a lot about my granddad, which I reflected on actually with my PE in the moment. But then when I found out that he died, I was really like triggered back into sort of grieving for my granddad. And I think like how I managed that was I took extra supervision, and I spoke about it as well in the moment, and like I self-cared. How did you manage your mental well-being throughout placement?
I think for me, basically what happened was I missed the first couple of weeks of placement. So I'm only on my second week now, and everyone else is on their fifth or sixth week. And so I had to quarantine for 10 days after coming back from home to the UK. And basically in those 10 days, I was like, the last 2 days I'm going to prepare for placement, but before I'm going to like focus on myself and what I like. And if I want to watch a movie, I'm going to watch a movie. And so I think what I was able to do during those days was kind of like realize what I like. And so now when I'm in placement and I come back home, if I am tired, I will let myself feel tired and take a rest. And if I have energy, I am going to work. And it's something where it's like, just don't force yourself to do things. I've always been the person that would like force myself to like do things, and like, I'm tired, but it doesn't matter, I have to write a reflection, I have to do this, I have to do that. But that doesn't work on placement, because you're going to be tired the next day, and then you're going to come back and you're not going to be able to do anything. And so I think the best way to do it is, if you like calling your family, if you're like an international student, then call your family. And if you like cooking, then go cook. And if you don't, just order out. And if you want to paint, it doesn't really matter, just do whatever you feel like doing, because in that sense you still feel like yourself, and you still feel like, oh, I'm Jenna, I like painting and eating this and doing that. But if you're just gonna like go to placement, come back, work, and go to bed, because you're not, the time between coming back from placement and going to bed disappears in like 10 minutes. And so do things that you actually want to do. And like, again, plan everything. Like, I just plan everything. So I have like a laundry schedule, I have cooking schedule, I have everything. It's just whatever is better for you and how you think, do it.
Do it. So, yeah. Thank you. Bryony.
I'd say maybe this is advice you could probably take into everything, but it's really easy to get wrapped up, and it's just like, oh, like, I didn't communicate as effectively to the patient as I wanted to. Oh, I didn't think about things how I wanted to. I'm not doing it as I want. But I think the thing that's helped me the most is to, instead of focusing on the negatives, which is the really easy thing to do, is think about all the positives you're doing. And I'm not talking necessarily just in placement, but in your daily life as well. I mean, we're occupational therapists. We love looking at people's activities of daily living, like what, we've got to think about our activities of daily living. And the fact that, we're on placement in a pandemic with really difficult working conditions, doing the washing up is actually an achievement in itself, and thinking like that, like, oh, doing the washing up every day, keeping my room clean, so I'm coming back to a nice environment, making a fairly healthy dinner, maybe not, that's an achievement. It's an achievement, getting up and getting the bus into work, just sitting and thinking like, oh, not everything's going how I want is very easy to do, but I think you've got to think about everything else that's going on and all the adversities you're also facing, and you're still managing to keep afloat. And I think everybody should see that as an achievement, and that mindset's really helped me.
And do you know what, Bryony, what you've just said has made me think that mindset, and being in that mindset, that's what you're projecting as well outwards. And so your patients, clients, your team members, they will be benefiting from you looking after yourself, and you seeing cooking a meal for yourself or getting the bus in as an achievement. And it's I've never really looked at it that way, so thank you.
The one thing is that I always take is, how can you look after somebody else if you don't look after yourself?
Yeah.
And you can only look after somebody else as much as you look after yourself. So if you're not looking after yourself, your care for somebody else is not going to be on that same level. It's going to be less.
Yeah, absolutely. Thank you. Imogen.
Yeah, like I kind of said before, keeping track of your goals, even if they're really small, it doesn't matter. If you achieve something every day that you didn't do the day before, even if it is on the weekend, just getting up and having a shower and getting dressed, it's still really good. And you should keep track of what you achieve. And I bought myself, before I went on placement, a wellness journal, which I do every night before I go to bed, just to keep track of my goals and what I've achieved that day, and giving yourself an intention for the day and having that in writing, I find really helpful. Also, I think when you first go on placement, you're thinking, oh, supervision, I need to write this, I need to write that. Your practice educators are having supervision themselves. your practice educators have like CPD to do as well, just say to them, do you mind if I take an hour this afternoon just to write up some reflections? And they're going to be fine with that. They've always got stuff to do as well. And part of your placement is to write these. You're not expected to use all of your weekend and all of your study day to write up those extra little bits.
Absolutely.
If you're worried, they're always going to give you time. And yeah, just take time for yourself. Find the things you enjoy, like Bryony said, and make sure you take some time to do them. As soon as I get home, I always make sure I have a cup of tea and just sit for at least like 10 minutes just to drink my tea. You've been on your feet for 8 hours, rushing around, looking after people. You shouldn't feel guilty to take 10 minutes to have a cup of tea and watch something on Netflix. And also, if you have a pet, I really recommend just going and sitting with your pet, because I find it so therapeutic just sitting with my cat like every day. I think I'm going to employ him as a therapy cat at some point. But yeah, really helpful.
I would just say it's important to keep it that like especially on your first placement, don't be hard on yourself. You're going to make mistakes. Everyone makes mistakes. Your PE was a student at one point, and they probably made some mistake, kept them up at night. Our lecturers made those same mistakes at some point in their it's natural. As long as you reflect on it, you're going to grow from it. Think about on my bike ride home, but it's natural. We're human. And I'd say it's important to keep up your hobbies outside of placement. Like I'm into like yoga and biking. Keep those things up when you're outside of placement. You need those. And yeah, and it's a busy time of it's going to be a busy time of your coursework. So it's important to keep that occupational balance we all talked about.
Yeah, absolutely. Jeff, how did you keep your mental well-being up?
I probably didn't do a good job on that first placement. I was just so tired every single day, like absolutely spent. So I think Seamus is right. It's important to keep that occupational balance. Probably just dedicate some time to your hobbies or something. For me, all I did, I don't know. I was just so tired every day. I just go back, just eat, just like read for an hour and just go to sleep and just repeat the same thing for 6 weeks. But if you have, maybe even if you don't have the energy, just try to force yourself to do something else to get your mindset out of placement, because it's pretty draining if that's the only thing you're doing. And that's what I experienced. I was just absolutely drained for 6 weeks. So
yeah,
I'd say on top of my early recommendations, get enough sleep and eat nutritious meals.
Eat
because your body needs fuel. Eat a big breakfast, honestly, because during placement, because especially like most first placements are in an acute setting, and you're on your feet, your brain is active, and eat a big breakfast, eat a big lunch, and a nutritious dinner, because your body's craving fuel.
Needs the energy.
Absolutely. Like 100% agree. My breakfast went from being like, maybe it was a bowl of cereal, to being a bowl of cereal and like 4 pieces of toast at one stage, because the commute, obviously, like I was walking and you were biking, and that burns energy as well. So one tip that I got given, and I think Seamus, I remember giving this to you as well just before you started, but it was a brilliant tip. Have like sugary boiled sweets in your pockets all the time. So if you need like a quick sugar rush, then you've got like boiled sweet or something that can really help.
Yeah, I had nuts. Like,
Yeah,
nuts,
have
that
snacks.
protein, energy.
Yeah.
Just bring nuts every single day and just snack on them. That's a pretty useful thing.
Yeah, it's very easy to not eat well, and then the patient biscuits they're always around as well, which is it's a dangerous territory once you open a packet of those. You don't stop.
So I think there's a few points for this. First off, Farmability is a really relaxed environment, really sort of alternative, passionate people that were working there. So, I mean, I didn't do a clinical placement, but I imagine it's less stressful than a sort of a proper clinical hospital setting. You don't have the time pressures as much. You have an afternoon or a morning session, and within that, there's quite a lot of freedom and autonomy to choose what you want to do, choose what the service users want to do. So we were given in some sessions kind of free rein to choose, which was amazing. It was, I think, the whole sort of OT process, being able to choose and implement a plan, be able to see it through, and then to be able to see someone progress over the weeks, was really good. But I think another point that I'd make is, if you have to work outside of your placement, I'd be really boundaried in what you commit to for hours during your time in placement. So I had a bit of a full-on few weeks because I worked from 6:30 until 7:30 in the morning before placement as respite care. I go to Farmability between 9 and 5, and then when I got back between, I think, 7 and 8 or 8 to 9 in the evening, I'd go back to work as respite care, which was good. I mean, it's fine to have the money, but it was long hours. And I was tempted a few times. They said, "Oh, could you stay an extra couple of hours in the evening or a couple of hours in the morning?" And I had to shy away a bit from that. But then also, I think it was things like, so on our study day on a Friday, I gave my other work enough notice so that I could cut back a few hours. And I think I ended up missing a few Friday shifts. So it's nice to have a full day, just completely relaxed.
You did work really hard. I mean, we'd finish on the farm and I'd go home and need to go to bed really quickly. And you'd be out doing your respite care.
But that's what I mean.
How do you do it?
I think so you've got to go for as much as you feel comfortable with doing. Like with my work, with my respite care, it's quite informal and I know them really well, so I can be really boundaried. But I just definitely consider how much you can do outside of your placement, because it is only 8 weeks, so it's really sort of precious. Is it 8 weeks or a bit more, a bit less? Around 8 weeks.
Yeah, depends what number placement you are.
I think it's a real precious time, and you'd be doing yourself a disservice by doing too much outside of your placement to not fully benefit.
And you need you time, don't you?
Yeah, definitely.
100%.